our Premium Tax Credits 101. I'd like to introduce our panel of experts who will be presenting today. First, we'll hear from Dania Palanker, Senior Counsel for Health and Reproductive Rights at the National Women's Law Center, where she works on issues including implementing health reform and expanding access to quality, affordable health care for women and families. Next will be Susanna Birdsong, a Family Economic Security Fellow at the National Women's Law Center, where she focuses on preserving and strengthening tax credits and other economic supports for low-income families. After Susanna will be Tara Straw, Senior Policy Analyst in the Health Policy Department of the Center on Budget and Policy Priorities, where she works on issues related to the implementation of the Affordable Care Act. And last but not least, we'll hear from Stefanie Costello, who is a health insurance specialist at the Centers for Medicare and Medicaid in the Office of Communications. And Stefanie primarily works on health insurance marketplace outreach and education. Before we dive into the presentations, we'd like to start with a quick poll. How familiar are you with the premium tax credit? So you should see a poll coming up on your screen that says, how familiar are you with the premium tax credit? And you have three options: very familiar, somewhat familiar, and not at all familiar. Please just choose one of those options so that we know we have a better sense of where we are going into the webinar. I'm just going to give it a little bit more time for folks to weigh in on the poll, and then I'll report back the results. Okay, I'm going to close the poll now, and it looks like 11% are very familiar, 45% are somewhat familiar, and 44% are not at all familiar with the premium tax credit. So it looks like we have a mix of folks joining us on the webinar today. Without further ado, I am going to turn the floor over to Dania Palanker. Dania, the floor is yours.
Thank you, Amanda. So I'm going to start by just giving a quick overview of what we will be talking about today. And just, I'm going to start by providing, my piece will be a general overview of access to health insurance under the Affordable Care Act to sort of set the stage for the more detailed conversation you'll be receiving from the other experts about what financial assistance is available, eligibility for the premium tax credits, how they work, and then moving into sort of what happens after signing up for health insurance, and now that it's January, what happens at tax time if people are filing their taxes. And then we'll hear from Stefanie Costello talking about the CMS information and resources and some outreach tools. So as I start with some of the overview of access to health insurance under the Affordable Care Act. You know, we've had the Affordable Care Act sort of rolling out in different parts of the law for a number of years now. And as a whole, the law is making health coverage more affordable and easier to obtain for millions of American women and their families. Just looking at the health insurance marketplaces alone and just that part of the law, in the first year, 8 million people, over half of them women, so 4.3 million women, signed up for health insurance through the health insurance marketplace. And 85% of that 8 million received some financial assistance to help cover the monthly cost. So that's the piece that's the premium tax credit. So the law really has sort of helped to create a marketplace where people can not only get insurance, but get insurance that's affordable and with the financial assistance. So we are in the open enrollment period now for 2015. And what that means is that people are actively enrolling right now, or they're actively changing their enrollment right now, or are able to for their 2015 coverage. And that open enrollment period runs about one more month. It ends on February 15th, 2015. And actually, for anybody to know that for yourself or to share the word that you actually, for those who need coverage or want coverage starting February 1st, that deadline is actually tomorrow because it does take a couple weeks for insurance information to process. So if you enroll by tomorrow, your coverage can start February 1st. If you enroll by February 15th, your coverage will start or have changes as of March 1st. And that's the basic time where most people are able to enroll through the marketplaces, and generally, even if they're looking outside of the marketplaces at individual coverage, although they can't get the financial assistance we're talking about. However, there are some opportunities to enroll outside of the open enrollment period for those who have special enrollment period times. And the special enrollment periods include situations such as life events, such as a marriage, the birth or adoption of a child, if someone has a change of jobs and they lose minimum essential coverage, they lose their health insurance. But those are the types of times where someone might have a special enrollment period. I would, as someone sort of looking at this, generally, if you're looking for health insurance, don't rely on having a special enrollment. You should enroll during the open enrollment because, you can only enroll outside of that period if you happen to hit one of the special enrollment periods, and they're not necessarily and that they're really sort of limited in what they are, but they do sort of provide really important opportunities for people. And then I want to give a quick note about the individual mandate or the requirement to have health insurance that is, is something that is also sort of a new part of the law that goes along with the expanding access to health insurance, is this piece of requiring individuals to have health insurance. And starting this past year, in 2014, every individual has to have minimum essential health coverage, which I will explain on the next slide. We'll get there. Or they must qualify for a certain exemption. There are some exemptions to the minimum essential coverage, such as those who would be eligible for Medicaid if their state had expanded Medicaid, but their state didn't. So there's certain situations like that where someone might be eligible for an exemption. And if they don't fit, they don't have coverage and they're not eligible for an exemption, they're going to have to make a payment when filing their tax returns, their income tax returns. So the people who did not have coverage in 2014 are going to be facing this payment when they're filing their tax returns coming up. So what is minimum essential coverage? This is obviously a relatively long list. You will note bolded is the coverage purchased in the individual market, including those plans offered through the health insurance marketplace. So anybody who's going and getting their coverage through healthcare.gov, who's getting the financial assistance, or individuals getting coverage through there without financial assistance, that is minimum essential coverage. Employer-sponsored coverage is Medicare Part A and Advanced Medicare Advantage plans, most Medicaid coverage, the Children's Health Insurance Program, and then these are some other sort of smaller programs or types of coverage that covers not as quite as many people as the others I've mentioned, but that are important coverage. And if you're at all concerned, if you have health insurance, they are supposed to report if they don't and notify you if they don't meet minimum essential coverage. But I would just note if anyone is concerned their coverage might not, they can always call the insurance company and just ask whether it qualifies as minimum essential coverage. And now I want to turn it to Susanna, who's going to sort of talk about what type of financial assistance is actually available under the ACA through these health insurance marketplaces.
Great, thanks, Dania. So first, I just want to mention that there are cost-sharing subsidies under the Affordable Care Act to help people cover the cost of out-of-pocket expenses like co-pays and deductibles. And these are available to individuals and families with incomes below 250% of the federal poverty line, which is just under $60,000 for a family of 4. But the bulk of today's webinar is going to be focused on the premium tax credit, which helps cover the cost of monthly health insurance premiums. And this is a subsidy or tax credit that's available to individuals and families with incomes between 100 and 400% of the federal poverty line. So again, for a family of 4, that's just under $24,000 up to over $95,000. And also just a quick note that lawfully residing immigrants with incomes below that 100% of poverty threshold, but who are ineligible for Medicaid because they've resided in the U.S. for less than 5 years, can also qualify for the premium tax credit. So again, the eligibility requirements for the premium tax credit include this household income requirement between 100 and 400% of the federal poverty line. Individuals and families must also not be eligible for adequate and affordable health care outside the marketplace, either through other government programs like Medicare, Medicaid, or TRICARE, or through an employer. And the definitions of affordable and adequate here are the affordable part is the portion that you must pay for self-only coverage, not family coverage, is 9.5% or less of your household income. And then to be adequate, it must provide minimum value or at least 60% of the expected total cost of covered services. And employers should be providing employees with summary of benefits and coverage that details whether your employer's plan meets this minimum value requirement. So if there are questions there, employers can answer that. And you must not be already enrolled in an employer-sponsored plan. And finally, you must be a U.S. citizen or a lawfully residing immigrant. And also, in most cases, married couples will only be eligible for the premium tax credit if they file their taxes jointly. But we did just want to note here, and this is something that the Law Center has done a lot of work on in the last couple of years, the IRS recently clarified that there is an exception to this married filing jointly requirement for survivors of domestic violence and abandoned spouses. So still married domestic violence survivors and abandoned spouses can certify on their tax return that they meet this exception by checking a box on the tax form. And it's just a relief box in the upper right-hand corner of the premium tax credit form, Form 8962. And they can still claim the premium tax credit and file separately from their spouse. And this is an exception that may be claimed for up to 3 years. So the premium tax credit can be used to buy one of 4 different types of health insurance offered through the health insurance marketplace. And as my father-in-law, who went shopping on the marketplace just last week, said, it's like the Olympics. You have different medal levels. So bronze is generally the least expensive plan, but provides the least comprehensive coverage and requires the most cost sharing, those out-of-pocket expenses like copays and deductibles. And then you go up in expense, but also comprehensive coverage until you reach platinum plans, which usually have the highest monthly premiums, but also provide the most comprehensive coverage and require the least cost sharing. And the premium tax credit is designed sort of on this sliding scale so that individuals and families spend no more than a certain percentage of their income on health insurance every month and every year. So families with incomes up to 133% of the federal poverty level will be required to contribute no more than 2% of their income toward their monthly premiums, while families with incomes up to that 400% of the federal poverty line level will be required to contribute no more than 9.5% of their income toward their health insurance premium cost. And the premium tax credit comes in and covers the difference between the actual cost of the health insurance plan, and this is using a standard benchmark, which is the second lowest cost silver plan available in that particular market, and the family's expected contribution. And we'll go through an example in a couple of slides. This slide, I realize, is a little overwhelming, but hopefully will be useful as you go back through these slides later. It just shows at the various income levels, the various percentages of the federal poverty level, how much of somebody's income is expected to be contributed toward their health insurance premium cost and what that would look like on a monthly basis. So this slide just shows an example of what somebody's premium tax credit would be versus their expected contribution at different income levels. And I just want to give a shout out quickly to Tara and the Center on Budget for creating some amazing examples on all sorts of things related to the premium tax credit. So this example has been adapted from one of theirs in a previous presentation that they gave. So this is Alice, and she's 24, and she has a health insurance plan that is costing just over $2,500 a year. So in the first example, Alice's income is $23,340, which puts her right at 200% of the federal poverty level. So her expected contribution at that income level is going to be no more than 6.34% of her income, or just under $1,500 a year. So the premium tax credit is going to come in and make up the difference between the actual plan cost, that $2,535, and her expected contribution, that $1,480. So her premium tax credit is going to equal just over $1,000, or $1,055, and she'll be expected to make up the difference on a monthly basis. Let's say that Alice gets a raise at work, and she's now making $29,175. So her expected contribution at this higher income level goes up to just over 8% of her income, and that increases her expected contribution to just over $2,300, and thus decreases the amount of her premium tax credit to $172, making up the difference between the actual plan cost, $2,535, and her expected contribution of $2,363. So the premium tax credit changes based on income level and obviously provides more assistance to people with lower incomes in an effort to keep insurance affordable. So how does, can you go back to that graph slide? How does plan choice affect what people will pay? So again, looking at Alice, who's eligible for a premium tax credit of $1,055 at her income of $23,340 a year. First, you look at income. What percentage of her income will she be expected to pay? So at her income level, 200% of the federal poverty line, she's expected to pay 6.34%, or $1,480. The cost of the benchmark plan is $2,535. So the difference is her premium tax credit amount, which is $1,055. But Alice can go on the marketplace and she can buy, she doesn't have to purchase that benchmark silver plan. She can purchase anywhere from a bronze to a platinum plan, and depending on which plan she decides to buy, she just may be contributing more or less than the benchmark plan would imply. So no matter which plan she chooses, her tax credit remains the same, and she either pays more or less to make up the difference between the premium tax credit and the plan cost. So let's say she opts for the lower cost bronze plan with higher deductibles and out-of-pocket costs because she doesn't anticipate really needing to go to the doctor that much this year, or instead she knows that she will be going to the doctor a lot and so wants lower out-of-pocket costs and chooses the gold plan. She'll just be paying more or less every year depending on what she needs, but her premium tax credit will stay the same. So applying for the premium tax credit, individuals and families can apply for the premium tax credit when they sign up for health insurance through the marketplace in their state. And you can get to the federally facilitated marketplace or your state marketplace all by going to healthcare.gov. When they sign up for health insurance, in order to be eligible for in order to find out if they're eligible for the premium tax credit, they'll need to provide information about their family's income, the other people in their household, and whether their job offers them health insurance. And based on that information, the marketplace then determines eligibility for tax credits, as well as those cost-sharing subsidies I mentioned in the beginning, Medicaid, and the Children's Health Insurance Program. And also just a quick reminder, we're going to be saying this over and over again today, the open enrollment period ends February 15th, so in just over a month. So if you know people who are thinking about signing up and haven't done so yet, encourage them to go to healthcare.gov or to call that 1-800 number to get started with the process today. There are two options for receiving the premium tax credit. You can get it now on a monthly basis as soon as you sign up for health insurance, or you can get it later. You can opt to receive it at tax time. The vast majority of people who are eligible for the premium tax credit are opting to receive it in advance to help them cover on a monthly basis the cost of their health insurance premium. And if you do choose to wait until tax time, the family would then be responsible for covering the entire premium cost every month. And then when they file their taxes, they can claim the premium tax credit and either reduce their tax liability or get that amount back as a refund. But again, the vast majority of people are opting to receive the tax credit in advance and on a monthly basis. So it's important that individuals and families remember to update the marketplace throughout the year if they are receiving the tax credit in advance, because the advanced premium tax credit is based on estimates of income and household size for the coming year. So when you sign up for health insurance, let's say somebody is signing up for health insurance right now, they're going to give an estimate of what they think that they will be making and also what they expect their household size to be for the entirety of 2015. And if their income changes at any point during this year or their household size changes, they need to update the marketplace with that information when it happens, because it could impact the amount of their premium tax credit, the advanced premium tax credit that they're receiving on a monthly basis throughout the year. And any changes like birth or adoption of a child, marriage or divorce, change in income, or an employer-sponsored insurance eligibility are these things that can impact the amount of the premium tax credit. And we want people to avoid tax time surprises, and so update the marketplace throughout the year if any of those things do occur. And it's really simple to do that. You can just go onto healthcare.gov, and right there on the home page, you'll see a spot to click on and do that. So an example of this on the next slide is Maria enrolled in health insurance through the marketplace in November of 2013, so right after the marketplace opened. And she projected that her income, her 2014 income, would be just under $28,000. In August of last year, she started a new job and became eligible for employer-sponsored coverage on September 1st of last year. So Maria is responsible for contacting the marketplace to let them know about this change, because she may only be eligible to claim the advanced premium tax credit for January through August of last year, because she would have been eligible for employer-sponsored coverage for the remainder of the year. And we don't want her to have to pay back the amount of advanced premium tax credits that she received and receive that tax time surprise when she files her taxes this year. And Tara is now going to go into more detail about what happens at tax time and what people should be expecting when they file their tax returns this year and are dealing with the premium tax credit for the first time.
Great, thank you. So we're just switching over the slides. And I'm not seeing any slides. So maybe you would like
Sarah,
to switch them back.
we do see your screen, but
right, there are no slides.
the slides is.
So why don't you take it back and we'll see if
Okay. All right, just as a heads up, I think we may not have your animation in the PDF form, but I can go through the slides here.
Oh, okay.
Sorry about that. Okay.
All right, there we go. So sorry about that. At tax time, people will have to account for whether they had coverage. And if they didn't have coverage, then they'll have some other options. So for most taxpayers, and it's maybe 2/3, maybe more taxpayers, everyone on the tax return had coverage all year. And so in that case, people will just be checking a box for full year coverage, and that's it. So there are some terms that that we're going to be using, and just wanted to make sure everyone's using the same vocabulary. So there is reconciliation. Reconciliation involves the premium tax credit. So if people receive the tax credit in advance, then one of their jobs will be to account for that on their tax return on Form 8962, and to make sure that they got the right amount of credit based on their actual income and household size. Because as we mentioned earlier, as Dania mentioned, it's all the initial advanced premium tax credit is done based on an estimation of what income will be. So at the end of the tax year, we know what the final income was, and so we need to make any adjustments to the credit. Exemptions, if you don't have a minimum essential coverage for all or part of the year, then there are exemptions that can be claimed on the tax return to avoid paying the penalty. And finally, for people who did not have coverage and did not have an exemption, there is a shared responsibility payment that is a calculation of the penalty for failure to maintain coverage in each month, and that's failure to maintain coverage by month and by person. So the taxpayer is responsible for everyone on their tax return making sure they had insurance or exemptions, and making sure to reconcile any premium tax credit that they may have. Next slide. So we're going to talk a little bit more about premium tax credit reconciliation. So anyone who took the premium tax credit in advance is required to file a tax return, even if they otherwise wouldn't have an obligation to file. And already people have available, I think Stefanie will talk more about this, people have available their Form 1095A if they got insurance at the federal marketplace, and they'll be mailed soon. And that's the Health Insurance Marketplace Statement, which gives the taxpayer all the information they need to either claim their premium tax credit on the tax return or to reconcile the credit to make sure they got the right amount. As Stefanie can talk about later, the 1095A is available in the enrollee's online accounts, and that's what it looks like, just a little picture of the top form, and then there are a lot of numbers on it. Next slide. The credit is calculated based on actual income, filing status, and household. So that means that if there was no premium tax credit in advance, so someone said, yes, probably eligible for the credit, but I just want to pay my full premiums, and then I'll see at the end of the year if I can get credit, then the taxpayer can receive that additional credit on their tax return. Or if someone said, well, I'm eligible for $100 a month in credit, but I'm going to hedge my bets just a little bit, and I'm only going to take $50 a month. Then the person can get that remaining $50 a month on their tax return. However, if the premium tax credit was disallowed, so we look back at the eligibility factors and find out that you're not eligible, or if too much premium tax credit was taken in advance, then all or part of that credit must be repaid. And you can see there the limits on repayment. So the limits are based on income, but also based on your filing status. So someone who files as single will have a lower repayment cap than other taxpayers. And note that people who have income above 400% of the federal poverty level will have no cap on the amount that they repay. They have to repay every dollar of the credit that they took in advance. So here is a quick example of how this might look. So we've got John, and he has a household modified AGI of $27,000, and that puts him at about 235% of the federal poverty level. So when you go through the formulas, you'll find out that his expected contribution was 7.52% of income. His benchmark, again, this is all done by formula. And he arrived at an advanced premium tax credit amount of $724, and he took that in advance. So he was having that amount of money paid in monthly installments to his insurance company to help supplement the cost of his premiums. Well, then John wins a $5,000 fantasy football prize league, which happened to one of my friends. His tax situation looks remarkably similar to this. And so that increases his income, which also increases his expected contribution. His benchmark is the same, but when you do the math, you find out that his premium tax credit amount now is 0. So his final amount for the year is 0, but he's already received $724 throughout the year. And that means that he needs to repay the full amount. Now, there was a repayment cap that applied to him, but it was higher than the amount of the credit, and so it didn't really help him bring down the cost of what he owes back. But he owes back the credit because his income was higher than he anticipated. So there are some exceptions to keep in mind for when a person's income falls below the premium tax credit range. So in general, a person has to have income between 100 and 400% of FPL to qualify. There's an exception for people who are, as was mentioned earlier, lawfully present immigrants who are not eligible for Medicaid because of immigration status. But there's also a special rule that applies when income falls below 100%. So if someone applies for coverage at the beginning of the year during open enrollment, they anticipate that their income will be at one level, but then, things happen during the year and maybe their income isn't quite as high as they thought by the end of the year. Well, there's a special rule if that income happens to fall below 100% of the federal poverty level. And that rule comes into play if the person was enrolled in a QHP, the marketplace estimated their income to be within the premium tax credit range, so between 100 and 400% of FPL. If advance credits were authorized for 1 or more months and the taxpayer was otherwise eligible for APTC. If all of those rules are met, then the person still gets to claim the premium tax credit, even though sort of on paper they look like they are falling outside of the range of 100 to 400%. This is basically the marketplace saying, based on your best estimate and our best verification, we thought you would be within that range. Now we're at the end of the year, you're not there, but that's okay. And in that case, the premium tax credit is calculated based on actual income. Next slide. So this is an example of that. So we've got Lisa and her son Jackson. Lisa is divorced from Jackson's dad. Lisa and David, her ex-husband, alternate claiming Jackson as a dependent on their tax returns, which is not uncommon. So when Lisa applied for coverage, she applied as just a household of one because she thought her son would be claimed by David in 2014. And you can see Lisa's income, and she has some child support, but child support is not counted in the MAGI formula. Next slide. So here, when Lisa applied, her income her countable income for MAGI was $15,400. That meant that her expected contribution was 3.06%, and you can see what her advanced credit was of almost $2,700. But throughout the year, things happen, and one of those things that happened is that David failed to pay his child support. As a result, Lisa doesn't permit David to claim their son as a dependent, and in tax land, there's a kind of a rationale for this, but Lisa, as the custodial parent, has the ability to say yay or nay on whether David can claim the kid. So that changes Lisa's scenario a little bit because now Lisa's a household of two. That means that even at the same income level, her federal poverty level amount is lower, and now she's below 100%. So does that eliminate her ability to collect premium tax credits? And the answer here, because of that special rule, is no. And in fact, Lisa's going to get an additional credit because her expected contribution used to be 3.06%, but now as a household of 2 with an FPL of 99%, her expected contribution is lower. And so that means that she's going to get an additional $163 added to her tax refund. Next slide. So, so that's the reconciliation of the premium tax credit. And now we're going to talk just briefly about exemptions. Exemptions, again, are available to people to avoid paying the penalty for not having insurance. They're available in many cases by month and by person. So here's a little summary of the exemptions that are available directly on the tax return. And this just gives you an idea. You know, we think, you know, you look at this and there are a lot of options and it looks a little complicated. But what I like to keep in mind and what I like to tell people, I train tax volunteers and I like to tell them to remember that the fact that there are a lot of options here is a really good thing for a taxpayer. So you can see under in the box for Part 2 that there is an exemption that's available for everyone on the tax return for the whole year, and that's for a person who has income below the filing threshold. If your income is already so low that you don't need to file a tax return, then you also don't need to pay a penalty, even if you didn't have insurance. There is a special exemption that's down in yellow, which is for an individual for the entire year. This is really important for people who are in states that did not expand Medicaid. For people who fall into the coverage gap, which means you have too much money for Medicaid in your state, but too little money to be in the range for premium tax credits. So this exemption is available for people who have income of less than 138% of poverty and who live in a non-expansion state. And it can be claimed directly on the tax return for 2014. And then we have other exemptions, like there's an exemption for people who, for someone who is undocumented. There are some exemptions related to religion or related to Indian tribe status. There are exemptions related to the affordability of insurance. And also if you had certain short coverage gaps, so if you had a gap in coverage of 1 or 2 months, or if you had a gap at the beginning of 2014 because maybe you didn't realize that there was a coverage requirement, you were just trying to get yourself organized. As long as you had coverage by May 1st, then January, February, March, and April, you can get an exemption. Next slide. So here's an example of the Medicaid coverage gap exemption, and this is really important. This is only available in this way for 1 year, as far as we know right now. But I think it's going to be really beneficial for people who are in states that did not expand Medicaid, which is an awful lot of low-income folks. So this exemption applies to people who resided at any time during the year in a non-expansion state and who had income below 138% of poverty. So these are folks who would have been eligible if the state had expanded. So in this example, Rashid was uninsured. His wife had insurance through work. They have a daughter who is covered by Medicaid. And their household income is at 128% of FPL for a family of 3. They're in a non-expansion state. So in this case, Rashid qualifies for an exemption because his household income is below 138% of poverty and he lived in a non-expansion state. And he qualifies for this exemption for the whole year, even if he had other insurance options, like even if his wife's coverage was available to him, or he could have got coverage and he could have been eligible for premium tax credits. He's still eligible for this exemption. Next slide. So here are some more exemptions, and we won't go through them all. But these are some exemptions that are available from the marketplace that are hardship exemptions. There are other exemptions available from the marketplace, but most of those could also be claimed directly on the tax return. So we highlight these in particular because these are only available through the marketplace, which means someone who's in one of these situations maybe doesn't have any exemption available to them directly on the tax return. They can apply for an exemption on one of these bases. Next slide. And here's a little bit more information about applying for a hardship exemption from the marketplace. You've got to print out and mail the application, and even though many states use healthcare.gov, other states have their own state-based marketplace. For people in every state except Connecticut, they go to healthcare.gov for exemptions. The processing time is going to vary now that we're in open enrollment, and people are sending in documents for that. But there are a number of categories. There are 14 categories of hardship, and there's a page of the application that tells you what kind of documentation you need to submit in order to qualify for different hardship exemptions. So this is just a snapshot of a couple of those. But you can check out that page of the application, which tells you if there's any additional documentation necessary. Next slide. And as we said, for people who don't qualify for an exemption or who don't have health insurance, there is a penalty. The IRS calls this the Individual Shared Responsibility Payment, ISRP. Some people just say penalty. Healthcare.gov refers to it as a fee. But here are the numbers. In 2014, it's the greater of $95 per adult or 1% of income above the filing threshold. But what's really important is not those specific numbers, but what happens over the next couple of years. So you can see that the numbers increase a lot over the next few years. And so it's really important to talk to taxpayers about what it means to have this obligation to have coverage, because the penalty gets quite steep over the next few years, and we don't want people to be surprised. Next, please.
So I just wanted to, in the next couple of slides, cover some resources that will be helpful, hopefully, for you all going forward. If people need help applying for or taking the premium tax credit and filing their taxes this year, because this is also new and different, just wanted to make sure that everyone knew about the IRS-sponsored VITA sites, volunteer income tax assistance sites that provide free tax help to people with incomes below $50,000 generally. And to find a VITA site near you, you can call the IRS's free hotline or visit that link there. And the IRS also coordinates with the ARP to offer tax help to people with low and moderate incomes, with special attention, of course, to people age 60 or older through a program called Tax Aid, and you can access that by calling that number or visiting that website there. And then finally, individuals with incomes below $60,000 can use the Free File program with free tax prep software, and you can learn more about that program at the link provided. And then on the next slide, just a few reminders. Again, if you or anyone else that you're working with, clients, need health insurance and haven't begun the process on healthcare.gov yet, we just want to make sure that you remember that the open enrollment process, the open enrollment period ends February 15th, so just over a month from now. And even though that's true, if there are special enrollment periods throughout the year for people who may have changed circumstances due to life changes, like having a baby or getting married or losing insurance or income. So for people who don't meet that February 15th deadline, if they have these life changes or circumstance changes, they may be eligible for a special enrollment period, so just keep that in mind. Financial assistance is, of course, available. It's what we've been talking about at length today, so spread the word about the premium tax credit and cost-sharing subsidies that are already helping millions of families afford health insurance. And again, tax time assistance is available. So on the previous slide, those links to VITA sites and the AARP tax aid sites will be useful as you point individuals and families in the direction of resources and people that can help them fill out their tax returns and reconcile their premium tax credit that they may have received throughout the previous year. And then finally, before we turn it over to Stefanie, just wanted to give you a few links to more resources. The National Women's Law Center has a resource page on open enrollment, which is listed there, as well as a resource page on the premium tax credit. And if you're ready for premium tax credit 202 and beyond, which it sounds like some of you might be, the people who know a lot about this credit already, the Center on Budget and Tara and the folks there have put together an incredible Beyond the Basics series that really takes a deep dive into everything you would ever want to know about the premium tax credit. And you can access past presentations they've done and also get on the list to receive notifications about upcoming presentations at the link there. And now we're going to turn it over to Stefanie at CMS to talk more about that 1095A that people will be receiving in the mail soon, as well as other resources that CMS has available.
Thanks, Tara. We're going to go through kind of quickly to make sure I'll have the information, but to also allow for some questions. I'm Stefanie Costello from the Centers for Medicare Medicaid Services. Traditionally, we focus on insurance with Medicare and Medicaid and now the marketplace, but we are diving deep into taxes this year. So I'm going to present a little information about that and some resources. So next slide. So this is a similar slide to Tara's. One thing that I want you all to be able to take away from this is that if you have clients who received health insurance through the marketplace, they're going to need to know that they are going to get a form in the mail, a 1095A, and they're going to use that at tax time. So you can explain this to them just like they receive a W-2 in order to file their taxes. They're going to receive a 1095A just like they're going to file, and they're going to use that to file Form 8962. Similar to the W-2s, if they had multiple policies, if they switched plans in the middle of the year, if they moved states and had different plans, they're going to have multiple 1095s, and if they have more than 5 dependents, they're going to have more than one 1095. We have started mailing those. 1095s have started to go out. It's going to be a rolling basis. They are all going to be postmarked by February 2nd. So if you have a consumer and they've not received it and the date is January 30th, tell them to be patient. They all have to be postmarked by February 2nd again. But if it's a week after February 2nd and they don't have it, we encourage them to call our call center. It's also going to be available electronically in their health accounts. So if they signed up for health insurance and they have a healthcare.gov My Account, the electronic copy is going to be in there as well, so they can check that periodically. Those two are going to be posted on a rolling basis, so we'll be up by February 2nd. If the consumer wants to file before they get this, tell them they should wait because they need this form to file their taxes. Next slide. So what will consumers see? They will get an envelope. It's going to be labeled important tax or health coverage information. We're going to have a cover letter in there that explains everything. If they are a Spanish speaker, the cover letter will be in Spanish, although the form will be in English, and then it will be in English. If they need additional information, there's going to be 1095A instructions with line-by-line instructions that were developed by the IRS. Unfortunately, these are only in English. Then they will get their 1095As, which I explained, and then starting January, they'll be able to go onto healthcare.gov to download their forms, again on a rolling basis. So next slide. So the elements that are going to be inside the 1095, information about a tax filer or another relevant adult or his or her tax household if they were enrolled in the Marketplace Qualified Health Plan. Information that can be used to complete their federal tax return, including the monthly premium amount that they received, and then the amount of APTC, that's the Advanced Premium Tax Credit, that was paid to an issuer on the consumer's behalf. So all that information is important to reconcile the APTC on taxes, and that's why they need the Form 1095 in order to file their taxes. All right, next slide. So a little bit about the exemptions. There are the two types of exemptions. that you can get. One is from the IRS just by checking the appropriate box, so that'll be easy. And then there's several that are just in the marketplace, and Tara went over those. There is a really great website with a chart on irs.gov, so you can go to irs.gov and put in the search bar that you're looking for the exemptions chart. It'll pull up and it tells you all of the exemptions and where you need to go to get them if it's through IRS or through the marketplace. If it's through the marketplace, we encourage you to go ahead and get those applications in as soon as possible. The turnaround time will be somewhere between 2 and 3 weeks. Of course, if we have a large batch of those coming in at once, it might be delayed, but we encourage you to go ahead and get those applications in, and then tell your consumers that if they are applying for an exemption, that they need to make sure to get their the letter that comes with the approval, and then they'll have their exemption number, and that ECN number will be used on the tax return as well. So if they already have an exemption or they're applying for one, they need that letter as well. And then the complete list of exemptions, again, is on healthcare.gov, and then our call center can also help answer any questions. All right, next slide. So what is CMS doing in terms of educating folks? You know, as y'all indicated earlier, there's a good majority of you who didn't know a lot about this information, and we know that's true for most Americans. We want to make sure we're getting the word out. 75% of folks aren't going to have to do anything. They're simply just going to check a box on their tax return saying that they had minimal essential coverage for 2014. However, that additional 25% is really what we're focused on. So we are putting a lot of new content on healthcare.gov and irs.gov. We have a new landing page called healthcare.gov/taxes. We are creating a web-based tax tool, and that tax tool should go live sometime this week, and it's going to help consumers figure out if they can apply for a hardship exemption, and then also to estimate their APTC. So keep an eye out for that, because we'll share with the National Women's Law Center once that goes live in some language so they can send that out to their folks. Again, the 1095As we're going to be sending out with instructions. We have new fact sheets which we've posted for consumers. So those are folks that you can hand out to your consumers that they might need. And then we also have for partners a number of drop-in articles that you can use to educate folks. We have some flyers. We have a PowerPoint presentation. We're in the process of developing some YouTube videos, some short videos if you want to put those in waiting rooms or just use those to educate yourself. We're doing a lot of training and outreach like this, and we're also starting an email campaign this week. So if we have contact information in the marketplace, those folks who signed up for health insurance, they're going to start getting emails this week letting them know that this is coming down the pike and to look out for their 1095s. We're also going to start this week our social media strategy. So if you don't already, we encourage you to follow healthcare.gov on Twitter and Facebook. And then look out at the end of the week. You might see some specifics around taxes, and we encourage you to retweet, like us, share, and all of that great social media work that we can do. We're also going to be doing some press outreach. We had a press statement a week ago with the secretaries from HHS and Treasury, and there might be a few more coming out, so keep your eyes open for that. And then the IRS is going to be doing some messaging. We'll also have some talking points which we're going to release. So next slide. So this is the tax tool. It's the online tool. Hopefully sometime this week we'll have that. It will provide steps in filing your taxes for certain consumers. So if you didn't take or qualify for the advanced premium tax credit and you want to see if you do, you'll be able to use this tool, and then to see if you qualify for an exemption. So I won't go into too much detail, but when we send some more information about that, we encourage you to go online and check this tool out. It will be on healthcare.gov/taxes. Next slide. So here are the resources. I encourage you to take some time to go over these. Marketplace.gov/taxes. And outreach staff, you can go to marketplace.cms.gov. We have these grouped into certain pieces. So we have education materials in what we call the already enrolled folks. So materials that are designed specifically for those who enrolled in the marketplace last year. And then we have additional materials that are for people who have not enrolled in the marketplace.
and then we have a training material at the bottom. I do want to say, except for the training material, all of our other materials are available in English and Spanish if you serve Spanish individuals. So go online and take a look at that. Next slide. Open enrollment we've talked about. Again, if you want coverage to start February 1st, you need to enroll by January 15th, and open enrollment ends February 15th. So we know that the penalty goes up this year, and we want to go ahead and get people enrolled. There are some people who might end up paying around the same amount for the penalty as they would for health insurance, so it makes more sense to get health insurance for a number of reasons, but some people are driven by financial reasons, and that's a good selling point there. So make sure to get them to go to healthcare.gov. And I think this is, or one more slide, I believe. Yeah, so here's just the dates again. I also want to take a moment to let you know we just have an announcement that went out, and I'll send this along to folks the National Women's Law Center, but mark your calendar on January 16th. We have a special call with Health and Human Service Secretary Sylvia Burwell and the U.S. Treasury Secretary Jacob Lew, and they're going to discuss the importance of the tax season coming up. This call will be January 16th from 9 a.m. to 9:30. Dial in early. We expect a good turnout, and I will send this information and the RSVP out after the call.
Great. Thanks so much, first of all, to all of our presenters. As you all saw, we had a full hour of content. So we are pretty close to our end time, but we do want to take a couple questions. If we're not able to get to all of the questions, we can also do like a follow-up Q&A document. As a reminder to everyone, we have recorded the webinar, and we'll put that up on the Law Center website, as well as the slides and any of these additional resources that have been mentioned. And you'll get a link to all of those resources in the next couple days. Susanna, Tara, the first question we have is for you. If someone anticipates making $12,000 in a non-Medicaid expansion state and ends up only making $10,000, does this really mean that they will not be penalized at the end of 2015 when they file taxes?
Correct. So I just want to be sure when we're saying penalty, we're talking about the same thing, though. So the question that is being asked is if you start the year anticipating that your income is above 100% of poverty, but then by the time you get to the end of the year, you realize you didn't quite make it there, and you're below 100% of the federal poverty level, which would be the sort of the starting point for being eligible for premium tax credits, then the answer is, do you have to pay it back? The question is, do you have to pay it back? The answer is no. You don't need to pay that back just because you fell under 100% of poverty.
Thanks, Tara. We have another question. This one is for Dania. How does COBRA eligibility affect the premium tax credit?
So COBRA is treated a little differently than a general employer offer of coverage. So if you are offered COBRA, as long as you don't enroll in COBRA, you can still be eligible for the premium tax credit, assuming you meet all the other eligibility requirements. So regardless of how much that COBRA would cost you, you can waive it and enroll in the marketplace and get the premium tax credit. Now, if you do enroll in COBRA, then you are enrolled in minimum essential coverage. COBRA, like other employer coverage, like many other programs on that list that I showed as minimum essential coverage, is minimum essential coverage. You don't have to pay the penalty. You don't get the tax credit for it, though. So you only get the tax credit then if you've waived COBRA and enrolled in your coverage through the marketplace.
Thanks, Dania. Unfortunately, at this point, we have reached the end of our webinar. Again, some of these additional questions we can put in a document and circulate along with the additional resources. So at this point, I'd like to thank you all for joining us today and thank our panel of presenters again for all of the great information and presentations. please stay tuned for some additional follow-up resources as well as the slides and recording in the next few days. And with that, I will say thank you everyone for joining us and have a good afternoon.